And hello viewers, welcome for the lunchtime news. To get information on what is happening internationally and around the country, my name is Videlis Njoki and that is my sign name. Our sign language interpreter is Wanjangede. And on to our first news. President William Ruto on Tuesday received the Jukwaa La Usalama Report, a comprehensive document detailing security and governance concerns raised by citizens across the 47 counties through the Ministry of Interior's Grassroots Dialogue Forum. The presentation of the report marks the culmination of the nationwide Jukwaa La Usalama Safety Platform initiative, which saw top national security officials engage with communities for months to gather actionable intelligence and feedback of peace, safety, and service delivery. While receiving the report, President Ruto commended the Ministry of Interior for steering the consultations and committed that the recommendations would be translated into concrete action by the government.
The press of the bazaar, this will be the launch of the Jukwaa report. May I request that we all sit down? The rest of us can sit down kindly. Tuweze kuketi. Ndio wapiga picha pia wapate picha mzuri. And Your Excellency, in 3, 2, 1, and the launch of the report. Ndio hiyo basi, Jukwaa La Usalama Report. After extensive collaboration and interaction with the people on the ground, we now have the report ready. Your Excellency, just as a sample, allow me to also invite a few who are going to receive while you're still there so we can remove the buzzer. And I'll invite CS Public Service to come and receive a report on behalf of the public service. CS Public Service, akuja apokee report. Makofi kwake. Followed by CS Labor. CS Labor to also.
And on to our next news. The National Transport and Safety Authority, NTSA, in collaboration with the Traffic Department, has announced a major intensified crackdown on errant motorists and drunk drivers ahead of the busy festive season. The move is aimed at drastically reducing road fatalities and promoting discipline on the roads. The multi-agency operation will feature the return and intensified use of the controversial breathalyzer Alcoblow, alongside mobile courts and intensified speed enforcement across major highways and urban centers.
We have come to the observation that most of the traffic accidents occur during night hours. We are also going to enhance the use of breathalyzers to detect drivers who are driving under the influence of alcohol. And even this mobile court will reduce these complaints of bribery along the public roads. And any member of the public who happen to see an officer engaging himself in a corrupt practice would be able to see the toll-free number. They can, even if it's a passenger seated and the vehicle is stopped, then you can peep in and see that. And even now I've been receiving videos of officers receiving bribes along the public roads.
To make sure that all these trucks go for inspection. Every accident in Kenya, and a truck is involved. And these trucks are killing in big numbers.
And on to our next news. The Teachers Service Commission, TSC, has officially terminated its decade-long medical scheme partnership with private insurer Minute, migrating its more than 400,000 members and their dependents to the government-run Social Health Authority, SHA. The transition, which officially began Monday, marks a significant change in the healthcare provision for the teachers. TSC leadership confirmed that the rollout is underway, with the initial batch of 294 teachers successfully processed under the new system.
42 teachers transited into the new scheme.
As at 10 a.m. this morning, 249 inpatient cases had transitioned into the new scheme.
It is still the same allowances that are going towards the medical cover. So nothing changes. Everything remains the same as long as we get quality medical care.
We are hopeful that this insurance cover is going to solve several problems where teachers have been struggling in hospitals.
Matibabu yote watoto wangu wote wawili imekuwa 5,650. Tukilinganisha na ile matibabu ya ile cover ya kitambo ilikuwa huwezi fikisha 2,000 kwa siku kwa mtoto mmoja.
And on to our next news. A major political shakeup is imminent within the two dominant parties, the ruling United Democratic Alliance, UDA, and the opposition Orange Democratic Movement, ODM, as both move to initiate disciplinary action against members of parliament accused of defying party lines. The planned purge comes in the wake of recent by-elections where several MPs and senators were accused of campaigning for or supporting rival candidates on an act both parties view as severe breach of loyalty and discipline. And on to our next news. Migori County faces a significant challenge in the fight against HIV and AIDS, reporting an estimated 99,510 people living with the virus as of 2024, positioning it as the fourth highest county nationally for positive individuals. According to Migori County Executive Committee member CECM for Health, Caleb Opondi, the county also recorded 1,572 new HIV infections in 2024, making it the second most affected county in terms of annual new cases, trailing only Nairobi.
We are ranked number 4. And currently 99,510 people are infected with HIV, and annual infection in Migori County stands at 1,572, with the annual death of AIDS-related cases being 1,041. And those ones who are on life-saving drugs and are HIV positive are 77,114. As a county, under the leadership of His Excellency the Governor, Dr. Chilayako, we have put so many strategies so that these new infections, together with the teenage pregnancies and SGBV, can be reduced in Migori County. We are working with partners. We are working with the national government agencies. We are also working with other stakeholders in the education sector.
Migori County, we have a total of 99,510 estimated people living with HIV. Out of these, around 80,000 are on treatment. the new infection as at 2024, we were at 1,572. Majority of those who are bringing new HIV are young people. And that's why the theme for this year is focusing towards them, because we are having one goal, one race as we end triple threat. And triple threat is affecting majorly young people who are bringing a significant percentage in terms of new HIV infection.
We have worked closely with the Compassion International. We have worked closely with the Luala community. We have worked closely with the network of people living with HIV, NEFAC, the Kenya Network of Positive Teachers, Kenepote, and various stakeholders. And we are very happy that we have rallied together under the theme One Race, One Goal to ensure that we tackle the triple threat.
We implement HIV prevention program in Migori County, working together with the Migori County Health Department and other stakeholders. We are reaching out to fisherfolk community, especially in Nyatike sub-county, because fisherfolk community are one of the communities that have high elevation in terms of vulnerability towards HIV infection.
And lastly, the government is making a renewed push to significantly increase domestic coffee consumption to 10% by the end of next year, a substantial leap from the current 3%. Cooperatives and MSMEs Cabinet Secretary Wycliffe Oparanya made the announcement during the inauguration of the National and County Steering Committees on Coffee Revival. Mr. Oparanya emphasized that Kenya's domestic uptake of its own coffee severely lags behind neighboring countries, a reality he insisted must change to ensure the farmers secure better earnings and the entire coffee value chain achieves stability.
But is the second producer of coffee. Why? Because in Ethiopia, local consumption is quite high. So we have said in Kenya, the local consumption of coffee is 3%. But that is understandable, because at independence, coffee was being marketed as a superior drink, only meant for the whites.
This coffee is consumed locally. Then you remain at the mercy of fellows who are out there. If you are going to have a low consumption of coffee, please make it also affordable.